Hello, my name is Hamutal Dotan. I am senior editor of The Walrus, and I am here across a screen, as so many of us are these days, with Kevin Patterson. Kevin wrote a recent feature about coronavirus. It's called Anatomy of a Pandemic. And as those of you who've had a chance to read it have already picked up on, Kevin is a critical care physician in addition to being a writer. And after many of you read that piece of his, you had a number of questions for him about how we are all coping with COVID-19 and what the future might hold. And so Kevin has agreed to join us for a little bit of a chat about his piece and those questions. Kevin, thank you for doing this, first of all.
Oh, it's my great pleasure.
When you and I started talking about the piece that you would go on to write, that was back in January. And I'm wondering, for starters, whether your interest at the time was more theoretical and abstract, or if you even then had a clear sense as to how far this would spread around the world and how much it would be affecting our day-to-day lives here in Canada.
Well, in early January, I was interested in the outbreak in Wuhan as being a potential pandemic, which is a thing I've thought about along with many critical care doctors for a long time, and have had this sense that we're not preparing adequately for future pandemics. And I was interested in the outbreak in Wuhan as an opportunity to crystallize a conversation about that as a broad idea. But by late January, certainly even by January the 23rd, when the Chinese government locked down Wuhan and most of Hubei in the face of 500 cases and 17 deaths, it was starting to become pretty apparent that a very contagious novel pathogen had broken out there. And so as January proceeded, the concern became more and more concrete and less abstracted. The backstory to all of this, as we get into it a little bit in the article, is that episodic pandemics have been a normal feature of civilization, with this anomalous little 40-year period, 50-year period in the recent history where we've been spared this, with some exceptions. But the great influenza pandemics and cholera pandemics and things like that have not been a feature of our lives. And so it's always seemed likely that it was possible for that to recur again. And of course, tragically, it has.
How do you think that we're doing as a country in our response so far? Are we, in terms of our policies, in terms of the public's attitude, are we where you would be hoping that we would be at this point? Are we behind? Are we ahead?
Well, it's a big country and there's different circumstances in different parts of it. I think in general, we're doing well. We've done, on a per capita basis, we've done a lot of testing, certainly relative to the UK and to America. We're not at Korean levels, but we have done a lot of testing. I think the social isolation measures are being broadly adhered to and are already taking effect. The rate of transmission and admissions in British Columbia has really been slowed quite impressively. Obviously, Quebec has a big problem with their long-term care homes and outbreaks in that. That will probably be a feature of this for many months to come all across the country. I think there will be long-term care home outbreaks pretty regularly. And they're just hard to avoid as long as you have workers coming in and out of those homes and having some element of contact with their family and their coworkers and moving around in the world. An element of that's going to happen. And to summarize, I think that we're doing reasonably well. You know, we certainly haven't had a Northern Italy experience or a New York experience just yet. And part of that's luck. Part of that's slightly earlier adoption of social isolation techniques. And I hope it continues. It doesn't mean the problem's solved. You know, when we talk about the flattening the curve, there's nobody who imagines that the total number of cases is much affected by that. It's better for everybody if it's slowed. So the area under the curve remains the same. And how we manage that over the next several months is a very interesting question. There's not a lot of historical precedent for this, and we're all feeling our way. There's lots of ways to make mistakes, I'm sure, in the coming months, but so far we've done pretty well.
So we're now 2 and a bit months into it for the Canadian version of this. What is your day-to-day like in hospital and clinic right now?
Well, the tsunami of COVID patients hasn't arrived. There's been a trickle. We've seen a small number of cases, and I think there's many more coming. But once again, it's not a New York experience. The day-to-day experience is as much dominated by the anticipation of the pandemic as by the pandemic itself. Elective surgery has all been canceled. The surgeons are walking around desperately understimulated and looking to help out. And people are staying away from the hospital if they can at all. There's, nobody comes in for problems that aren't really quite significant and important. And so the hospital has a quiet feeling to it, which is not what we expected by mid-April. We expected it would be bedlam, I think. But I'll take this. This is good. People aren't dying very much.
I'm going to preempt what I am guessing many readers and watchers right now hearing that might think, and just ask this question to get it out of the way. Does that calm mean that we have all been overreacting?
No, this is exactly what we were trying to bring about. When you slam the brakes on and don't hit the deer that's jumped out in front of you, you haven't overreacted because there's been no damage. You acted, and that's what we've done here. So this is perfect. And boring is good. Boring is what we were looking for. And it's going to be an open question, though, about how long this can go on, because there are real world important costs to this kind of project. Economically, obviously, jobs loss, obviously, and they get bigger the longer this goes on. So it's going to be a tough question to know how long to maintain these measures and how severely to keep them at. We'll just have to feel our way towards the answer, I think.
So when we put the call out for reader questions, a few themes emerged, and one of them had to do with the environment and the ecology of this all, and if there are any sort of climate factors that are at play, and if that shapes what a pandemic future is like, and if climate change means that we'll be seeing more pandemics like this, or if they will be more virulent when they do crop up.
Yeah, that's a really interesting question. And I think you raised that question when we had our very first conversation about this subject back in January. And the answer isn't clear to me. I mean, we can say that this pandemic, like most pandemics, is a zoonosis. It's a pathogen that originally lived in another species, in this instance, probably bats, possibly with an intermediary host. As climate change develops and people are stressed from a food insecurity point of view, it's possible that there will be more contact in terms of people going into the forest looking for bushmeat, which created the Ebola outbreak in Africa, for instance. And so there's that link to climate change. I'm not sure that it's as obvious here, though, with the Chinese origin of this. The Chinese have long consumed wild animals for food, just as North Americans do, just as mostly all peoples do. And every time there's an interaction between another species and a human being, there's a chance of a pathogen being transmitted. There's a lot of people in China, and there's a lot of crowding there. So it's not astonishing from an epidemiologic point of view that the pandemics often arise there and break out there. Relating it to geography is another interesting question, and I think the answer to that is it's just too early to say. There is been this hypothesis that maybe the virus doesn't transmit well in warmer weather, and that we'll be given a reprieve in the Northern Hemisphere by the advent of spring and summer. There's not a lot of evidence to support that so far. We have an ongoing outbreak in India. It's quite warm there. The virus is flourishing, to say the very least, in New Orleans and Florida right now, and it's quite warm there. So we don't see a lot of evidence of that. And indeed, when we look at influenza, which historically, diminishes in March and April, and its seasonal variant, when we have a pandemic strain that everybody is susceptible to, there are ongoing cases throughout the summer. And we saw that with H1N1 in 2009. And we may see that as well with COVID-19.
So another question that came in, this is one from a reader named Maria, is whether there is or should be a global pandemic protocol, and whether our institutional bodies are handling this appropriately, and if not, whether we should be taking this opportunity to set up those structures so that next time something crops up, we're able to deal with it more effectively.
Yeah, that's a great question. I've thought about that a lot too. The relevant global structure is the World Health Organization. And I think the World Health Organization has been underfunded for many, many years. Trump just announced that he's ceasing American funding of the World Health Organization because he feels their management of the outbreak in China was imperfect in some degree, as opposed to his own responses. I see a future where the World Health Organization is much better funded, and the pandemic preparation is one of its key missions. And there's surveillance teams all around the world looking for novel pathogens with potential for interspecies spread. I see pre-prepared depots of ventilators and medications and hospital equipment that can be used to be brought into a situation where the local health infrastructure is starting to crumble. And then maybe just as importantly, I think the financiers and the economists have a contingency where if you have an outbreak somewhere in the world where there's a precarious economy, you have the ability to go in there and say, okay, everybody stay home and we'll pay your rent and we'll feed you for a month or 2 months or 3 months, however long it takes to shut this down. But it's really only quite wealthy people and quite wealthy countries that can do what Canada's done for the last month and not have everybody starving. So affecting these measures in the largest part of the world would be just impossible without substantial economic aid and support. And that needs to be all figured out in advance so it can be acted upon when the next pandemic is in its infancy. I'm quite optimistic that we'll respond to the next pandemic quite a bit more coherently and effectively than we have to this one. And fair enough, nothing like this has happened for 100 years. We've been caught a little flat-footed, but it's necessary that we think clearly about how to handle this.
Another set of questions that we got, and I'm just going to read a little bit. This is from a woman named Monica, who wrote to us from California. Sort of cluster around the sense that, quote, nothing will ever be what we once thought of as normal. And I think she's not at all the only one who has that sentiment. And I'm wondering whether you have any instincts as to whether we're feeling this now because we're in the thick of it and things will ebb eventually. And when that happens, are we going to go back to what our normal was? Or do you see signs that this is going to permanently shift our day-to-day life? And if it does shift things, do you have any sense of how?
Pretty interesting. So I think that we are in the thick of it right now, and it is difficult for us to see how this plays out. There are themes that have emerged recently that are somewhat reassuring. Wuhan has gotten back to normal. China has no new domestically produced cases and just a few re-imports, travelers from other countries, principally Europe, that have brought it back. They have if one can count on their data, but they have achieved local complete success in extirpating the virus. That's very encouraging. And in Canada, the curves have been substantially flattened, and I think that it's not unreasonable to hope for a much better, calmer circumstance than that which we were contemplating just a month ago. In terms of how all this shakes out, it's possible that a lot of excellent structural changes will be prompted by the pandemic. I wonder if the Americans will finally see the necessity of universal health care as a consequence of the vulnerabilities that are about to be exposed by the pandemic. There's more enthusiastic and broad-based discussion about universal basic income than I've ever seen in my life, which I think is an interesting development. On a more particular scale, I think work from home is going to become increasingly normal. Every employer in the country is experimenting with it right now and finding out that it's not such a bad thing, that it can work really well. So there's going to be broad-based changes that the pandemic catalyzes, I think. And many of those changes won't go back to the way they were 3 months ago. And in a lot of circumstances, that might be a good thing. Other bad things, though, are that, rock concerts, music festivals, movies, at the cinema, crowded cafes and restaurants. These are some of my favorite memories derived from those settings. And it might be a long time before those happen again. Much depends upon whether the virus ends up circulating in the global population on an ongoing basis. And that's possible. Only a tiny minority of the Earth's population has been infected, and it has immunity of any sort. And so a lot of epidemiologists and virologists are contemplating a circumstance where the virus circulates through the world and we're able to control massive outbreaks through the social distancing techniques that we've been living with for the last several weeks. But the virus won't be completely eliminated, and so will be an ongoing threat for maybe a few years. It's hard to know. The measures that the Chinese used to achieve such success probably aren't replicable in most of the world. If you're in countries that are financially insecure, where food insecurity exists at a baseline, I don't know how you pull off what the Chinese did. So the idea of the virus just being snuffed out planet-wide, that seems like a pretty optimistic proposition. So I think that we will be dealing with the virus for a long time, and our lives over the next many months and maybe a year or two, I think, might be quite significantly affected by it.
Another aspect of that, of what I'll call, what many people are calling sort of the after times, whenever those are, is a sort of collective processing and an individual processing of the toll that this is taking on all of us. Another reader named Anastasia is curious about sort of what you've learned, both in your study of the history of pandemics and in your own medical practice, about, and I'm just going to read this, what you can expect in terms of trauma-related outcomes following isolation and uncertainty and grief. Are we going to have a case of collective PTSD, do you think?
Well, I think we're all collectively quite anxious in the face of this uncertainty, with a real possibility in terms of the range of outcomes that could await us, including calamity. We're seeing that in New York. They're burying bodies in public parks. It's unbelievable what has transpired there. So we will all be marked by this for sure. And the best case scenario is that 2020 was just a crazy year, and we've gotten back to a life of some freedom and degree of healthfulness, and we look back at this as just being a really strange time. But it's also quite likely that this will not cease to be an issue that we look back on, that this will be an ongoing thing that we think about and deal with for a long, long time. That's just a great pity. The fact is that processes like pandemics, contagious diseases, preferentially hit the most vulnerable among us, the socially marginalized, the poor. The damage it will do to our society will be pretty significant. In terms of the collective sort of psychic response, there is this observation in times of national trauma that there can be quite a stirring sense of coming together where everybody works hard and pulls in the same direction. After earthquakes, it's long been observed that suicide rates plummet because everybody who's lonely and wrestling with their personal despair is out in the streets trying to help and pull bricks off of trapped people in the rubble. And so there's this energizing, stirring collective feeling that has old war vets remembering their crises as a youth with fondness, notwithstanding the horror that accompanied those events. So what we take out of this is partly determined by our own response to it. I would like to see us continue to pull together and continue to think hard about how our society can work better to safeguard the most vulnerable among us, and how we can use this as a check-in moment to think about how risk and vulnerability are apportioned throughout our community. And maybe that'll feel good. It won't feel good enough to balance out the tragedies that's unfolding, but maybe there can be an upside to all this difficulty too.
What do you think is most important about the situation that we're in that you're seeing being discussed the least? What are we missing in all this?
A couple things leap to mind. One is what we're doing now that has arrested the rapid spread of the virus. This itself is not sustainable indefinitely. We can't all stay in our apartments forever and still have the tools to keep our society together. It's so, how long can we sustain it, and what, how do you take the lid off the pot in a slow way that allows us to resume our lives and not have immediate enormous breakout of the virus? That's a question that's lingering in the background for all of us, and it's not answerable. And so, and maybe that's why it's not been discussed as much as it could be. And the other point too is, I've, for 30 years, I've worked in the Canadian Arctic, and I was just up on the shore of Hudson Bay a couple of months ago. And those northern Indigenous communities have terrible experiences with pandemics. In 1918, a third of the Inuit in Labrador were killed, and maybe a third of the Haida were killed on the West Coast. We haven't seen large-scale outbreaks of COVID-19 among the Indigenous communities, but I think it's coming, and I think it could be terrible. The fates have given us an opportunity to prepare a little bit more than, say, New York or Northern Italy had. And I wonder if there shouldn't be concerted, dramatic action right now to render those communities safer and less vulnerable. What that looks like is probably pre-positioning of medical equipment, getting doctors and nurses up there, and it would be a massive logistics project, but it's probably necessary.
Thank you for this. You have patience in your real life and day job, so we really appreciate you taking the time to talk through some of this. And hopefully in calmer times, we will be able to talk about other kinds of stories as well.
I'd like that. Thanks again. Be well.